My daughter at 15 years old was diagnosed with severe scoliosis. It was an overnight diagnosis that turned our world upside down and set us on a path of visiting doctors and hospitals throughout the United States, looking for surgical options to cure her condition. Once we met Dr. Lahner and the Mount Sinai team, it became obvious to us that this was the path that we were going to take. And Dr. Lahner was deploying an innovative technique known as spinal tethering. And we had the surgery at Mount Sinai. It lasted for 8 hours. And then we spent 2 days in the ICU recovering. What things went well for us is an interesting question, because it's an important theme is that care is subjective, and what's important to some is not or may not be important to others. And I say that because medical care is obviously the most important aspect, and our care went well. So as a result, the things that we remember as positives were the extracurricular things, the art therapy, particularly the dog therapy, right? That's actually something my family and I are never going to forget about that experience. It's hard to remember some of the other things because the care was handled properly. We really thought that the extracurricular items and the other things that the hospital provided really stood out and really made our time in the hospital as enjoyable as it could be. The challenges that we faced were really getting comfortable with the process and routine at the hospital. Specifically, when is your doctor coming to visit, for example? We're all anxious, we all want information, and we all want to make sure that our care is being handled appropriately. And when you don't know when you're going to receive information, it can be scary. And you have to balance that with when our doctor's available. So it wasn't always clear to us when we were going to be spoken to about how we were doing on our treatment. And the other thing I think was really how to prepare to spend extended periods of time at the hospital. How to prepare for that experience. What should we bring? What should we not bring? And really what was appropriate and what was inappropriate to ask. You have a button for pain, but you don't have a button for other things. And there are a lot of other things that happen at the hospital. And I think you feel a little bit insecure about those other things. And we at times felt sort of out on our own on an island with all the other things that we needed to be prepared for when spending time at the hospital. From personal perspective, we learned humanity, and when you're not perfect and you have to learn to deal with physical conditions, it humanizes you. I think learning about the hospital process, how it works, being through the process gave us a sense of empathy and a sense of wanting to give back, and which we've done. We've joined the council and are trying to do the best we can in terms of being responsible citizens and helping to make places that we've had to use better. The advisory council is hugely valuable for this specific reason. The council is made up of parents who come from various backgrounds, education, and experiences. And so our input is varied based on our experiences. And that's as opposed to the other sources of information at a hospital, who are those people that come out of the hospital industry and are trained in it. So it's the age-old contrast between data and analytics versus experience. And the most efficient process is not always the best process. You really need to hear from us crazy parents about the human experience in a hospital to smooth out the edges. You need the Family Advisory Council because our input doesn't come from the sort of the training tree and the hospital industry tree that influences everyone else. And so our experiences, I think, are wholly needed by the hospital simply for that reason. I think a way to make parents and families feel comfortable about things that are not directly related to your care, which could have just as big of an impact on your experience as your care, is letting them know, number one, that it's okay to talk to your healthcare providers about those ancillary things, number one, and number two, telling them who to talk to. Just as important as introducing your nurse who's going to be administering your care. If that's the person you can sort of come to and ask anything of, let everyone know, let the patients know that. I think we're intimidated that, nurses are going from patient to patient, and we don't want to. Um, First of all, we have to decide what's important and what's not, and are you not going to think something's important that we do, and then how do we deliver that message and to whom? And if there was a person who is directly identified as that person for anything else that you need, we'd probably feel more comfortable asking questions about things that we needed. We are scared when we come to the hospital, and we want information, we crave information. And when you include us in the process, regardless of the impact that it has, it makes us feel better. And when we feel better, we can help you and help our child recover or receive the care that they need. So it alleviates fear. Information alleviates fear, but also, to the prior point that I made, the most efficient process is not always the best process. And you need to hear from parents in order to create a comprehensive care plan. The hospital staff knows how to be efficient. They know how to deliver a product efficiently. But that, when you're dealing with the human condition, is only probably about 60% of what you need to deliver. And we all know that people can heal themselves when they feel better about themselves and when they're motivated to do that. And so when you get everyone on board and you have our input, one, you can get valuable information that you didn't have, but two, you can empower us to be motivated to deliver care. And that package is really what you're looking for. During recovery, because this was a spinal surgery, it was important to get up out of bed and to do some form of physical therapy. And our options were to walk up and down the hall. And at one point, one of the care providers suggested that we go into the stairwell and go up and down the stairs. And they brought that idea to the parents. We talked about it. We went and investigated the stairs, and we looked at them, and we decided that it was something that we could try, and we were included in that process. And it was a good idea, first of all. And I think that the parent involvement in that decision empowered us. I was motivated to have my daughter get out of bed and say, let's go back to the stairs, because it was this idea that I was involved with, as opposed to sitting back and watching. So that was a great example. Whether that PT process was going to happen regardless of our input or not, I don't know. But I felt like I was involved. It motivated me, which then that motivation flowed down to my daughter to want to do that PT. So it was a great example of including parents in the decision-making process, leading to positive results. An overall piece of advice that I would have for caregivers is that care is subjective. And what I mean by that is, you need to understand at the outset what's important to that patient and then address those needs. For example, if you have two different patients in two different rooms, and one hasn't slept all night because they've been in pain, and the other hasn't slept all night because they're uncomfortable, neither has slept. And one could have been solved with a pillow, and the other needs medical treatment. So we're all in the hospital setting. We're all scared, and we're all uncertain about what to do. Some patients may have that situation because medically their treatment hasn't gone well. They have a more medically serious issue. And so for those patients, the medical care is the most important thing. Recognizing that and administering care, comfort level, what kind of jello they may have had for lunch is less important. But the people in the room next door, their concerns to them are equally valid. They're equally concerning. And just so my advice would be to when you have a patient come in, be subjective, look at their situation and understand what's important to them, and then deliver subjective care. Focus on the things that you can tell are more important to them, because again, everyone's got the same fears. And if you didn't sleep all night, it doesn't matter why you didn't sleep. And so I would recommend that caregivers look at the situation from the patient's eyes and then deliver subjective care as best as they can for positive results.